If you're somebody who has to sit to work or study, and that means for most people they're sitting between 6 to 8 to maybe 10 hours a day, this video is going to have a lot of information for you. Okay, many of you who do this will already be suffering from low back pain, quite possibly mid-back and neck pain, due to the fact that you're sitting, as well as the fact that many of you would be sitting incorrectly. So in this video, I'll be explaining to you what the correct position to sit in is and why, what sitting in the incorrect position will do to your spine, and if that's you, what you can do to be able to help that. And one of those things is chiropractic adjustments with physiotherapy and osteo and other things as well, just to maintain it, because we have to sit, we have to work, there are other alternatives there. So this is my mate Gunston. Gunston's made an appearance again after all these years, all these months. What we can see there, Gunston is sitting in actually a really good position, but we can see that, and hopefully can see that the discs here down the lumbar spine are bigger than the ones in the neck, okay? The discs get bigger as we go down. That's for a good reason. That's because they take more load, okay? There's more load due to the weight of our body above that. However, when we're not sitting correctly, and that usually means when the buttock are further forward and we don't have this support, or we're in a chair that's not providing that support, we don't use a lumbar support, which we should, then the load on those discs increase substantially. And sitting, okay, the load when we're sitting is much more than what we're standing, and much more than what when we're lying, okay? So what we're looking at is a spine that, I'm using this one because Gunston's spine's a little bit rigid, but you've got to imagine when we're sitting further forward, okay, this is actually a position where firstly we're losing the curve of our lower back, and curves are important. Compare, for example, the curves of a giraffe, which doesn't have any curves, to, let's say, an owl or a flamingo that has two curves. Those two birds can turn 360 degrees, okay? Whereas a giraffe has very little mobility due to the fact that there is no curve in the giraffe's spine, okay? Now, when we lose that, we are firstly challenging our mobility because we're used to that after a while, so certain muscles shorten, ligaments, tendons, all the rest adapt to that. It's not mobile, it's not meant to be mobile without curve. Okay, all of our curves permit mobility, as I mentioned with the animal example. So if we're passing long periods of time in a rectified, okay, curve or spinal state, then obviously movement-wise will be limited. A lot of us, when we're sitting, let's say, like this slump forward, we'll get up and we'll be quite stiff. Okay, so after this, I'm going to show you what sort of adjustments and interventions we do in that case. And just lastly, what I want to show you and remind you is that the discs should be nice and thick. When we're sitting correctly, the load is increased, so therefore there will be an accelerated dehydration of the discs anyway. However, when we're sitting incorrectly, the load increases to a point where that dehydration of the discs is drastically accelerated, to the point where we are getting weakening of the fibers of the disc, which allow the nucleus to migrate, usually back posteriorly towards the spinal cord or to the side towards the nerve roots. That's why a lot of people who are sitting for many years end up with situations like this where they've got foraminal encroachment, pressure from a disc, a piece of disc hernia or protrusion on the nerve root, okay, which can end up causing sciatic pain or pain in the glutes or even pain referring to the inguinal area, okay? So thank you, Gunston. What we're going to do is now get my camera guy, Rodrigo, to sit in this chair and show us what a position where we're sitting correctly really looks like. All right, I've asked Rodrigo to come and sit in the way that we definitely shouldn't sit, but too many of us do this, whether it be home, in the lounge, at work in front of a computer because we're just bored and we sort of with time let gravity win and just throw us down. But what is bad, okay? The glutes, the buttock is way forward. Okay, I just explained the importance of the lumbar curve. Okay, so there's no way that we can sustain that lumbar curve, which should look like this, when we are actually sitting like that. Okay, and have another look here. You'll see that the dorsal curve is also affected, and the neck curve often ends up straightening, therefore accelerating arthritis and those disc problems that I mentioned, because it's actually forced forward. The ear should be above the shoulder. Okay? And when that's the case, the weight of the head falls on this area, the natural center of gravity can fall down through the hip and knee in a way that's not going to overload the base of the neck particularly. But when that ear goes forward, for every 1 centimetre that it moves forward, it actually overloads the base of the neck by 5 kilos, the weight of the head. That's why a lot of people who work like that or actually stand like that will just complain of this pain, because those muscles have to compensate for that and tighten. Okay, I know this is a post about sitting, and I know that sitting is generally related to low back pain if we're sitting incorrectly. However, it's really important to see how that position can actually affect the whole spine. All right, so what we're going to do now is get Rodrigo onto the table. I'm going to explain to you guys what's happening when I do the adjustment, and I'm also going to talk about strategies that you can employ in your life to minimize the effect of sitting if you've got no other choice, okay? So firstly, obviously we're going to get Rodrigo to sit up straight. So what I do here, Rodrigo, can you stand up for me?
Yeah.
And I ask the person, and I do this myself, to sit, make sure that they're sitting first, and they put their buttock right against the back there. So place that first and then fall back, okay? Too many people will sit any old way, and that might mean that the buttock's falling here further forward, so naturally their low back's going to lean back. When you make sure that your glutes, okay, your buttock, are encased nicely in this point here, this 90-degree angle, then you're pretty much guaranteed that the rest of the spine is going to be guided to that sort of a position. Once again, this minimises the loads due to gravity, which we can't escape. However, we can't escape them, as I said, but why increase that, by sitting incorrectly? All right, let's go and jump on the table. Okay, we've seen Gunston is a very conscientious worker. Gunston knows how to sit correctly, but even still, Gunston still needs spinal hygiene. Okay, so Gunston's receiving his monthly adjustment, okay, because he's sitting for a third of his life. So what's happening in this little part now, I want to explain to you guys what actually happens when you get adjusted by a chiropractor. Firstly, the chiropractic adjustment is extremely specific. A chiropractor will study at university 5 years to be able to learn exactly how to deliver a very fast vector and minimal force to a specific area. That is what we want. Those areas are the ones that are compromised when we're sitting or when we're in certain positions for a long time, or even after falls and accidents where certain segments of the spine simply don't recover their biomechanical function. They lose it temporarily, so they need help. Remember, when I'm talking about this, I'm not negating the importance of physiotherapy or osteopathy or even massage therapy, acupuncture, to be able to deal with the muscles that are here that we can't see on Gunston, okay? What I'm explaining is the role of the chiropractor to be able to specifically come in here and restore movement via the adjustment. This would be similar to recognizing that a car's wheel simply won't stay aligned in the day-to-day life of driving. There's holes and bumps and everything else, and that will need someone specifically, like a mechanic, to come along and physically realign that wheel. What happens if the wheel's misaligned for a certain period of time? It will overload the tyre. The tyre, in this case, are the discs. We don't want that to happen. They're like 70% water, so we don't want to risk that they'll dehydrate in that time. So you've seen that here on the model. Another really important thing is that when you see the articulations here, you'll see that you go to someone like a chiropractor who knows and fully understands the biomechanical function of the spine and has a license a license to take x-rays in Australia, but also a heavy emphasis in the course on radiography and radiology. So they can understand your MRI and understand your x-rays and know why they're doing an adjustment in a certain area, okay? So these articulations have a certain angle, which you won't notice when I adjust Rodrigo, but you will see here, if my hand place was here, and I can explain that that vector is going to go in a way that I'll specifically focus on that one particular joint, okay? These facet joints or articulations change their directions and angles according to what area of the spine they are. All right, thank you, Gunston. I'm going to call in Rodrigo, and we're going to do the adjustment. I'll remind you, and I mentioned this quite a bit, that Many people associate an adjustment or a treatment with a physio, osteo, or even chiro as being something that they need to be in pain and symptomatic with. By the time we feel pain, we've lost function for a significant amount of time, usually, unless it's an accident or fall that you can identify, and a recent one. Okay, so in general, when we're doing this, we're doing it to avoid pain, obviously, and symptoms later on, but we're doing it to, most importantly, maintain function and compensate for all the time we're sitting. All right, I just want this leg up a little higher. Breath in and relax. Very good. Okay, beautiful. Sitting up for me with your feet here. And when you hear that crack, as many people refer to, it's actually what we describe it as a cavitation. We've got to remember that nothing's breaking, it sounds like that. It's something that a lot of people have fear around due to movies with Hollywood actors breaking people's neck. It's not the way it happens, okay? That crack is actually a cavitation caused by the fact that there is a vacuum in the articulation, and when there is a separation of those articular surfaces, we get a little sound. Breath in and out. Let that out, Rodrigo. Let your head down, shoulders down too. Beautiful. Up again. Breath in and out. Let that go. Perfect. Right out. Shoulders down. Awesome. Now, I'll explain something. Rodrigo, we've talked about this many times because I've been adjusting him for a while. He works a lot on the computer, editing, and you can see that this area here, I'm not sure if you can see, but it is accentuated a little because of that time. So we talked about posture, but this is something really important for any of you who are changing this consciousness and want to respect what good posture is, knowing that the spine encases the nervous system. So if your spine's not good, it's going to affect the way your brain can communicate with the rest of the body. The same way that problems in your lumbar spine can cause sciatic pain because of that interference to the sciatic nerve. Remember that the organs in this area of your body, where the nerves go to, for example, your heart, lung, gallbladder, sexual organs, intestines, they don't have pain receptors. So we won't know as easily as we do in the sciatic nerve example when there's compression there. So I don't want to wait till Rodrigo's, let's say, 50, 60, 70 with osteo spurs, okay, osteoarthritic spurs, to the point where I can't do that adjustment. The idea is I would like to do that continually, just like brushing your teeth or going to a dentist every so often, every 3 months, I guess, for a clean, to make sure his spinal hygiene is intact and has him at 80 years of age the same state that he's in now. Rodrigo, can you lie on your back, please? Very good. And relax those hands there. Here we go. Good. One more. Good. Awesome. Okay, turning on your side to get up properly. Knees forward. Awesome. And away we go. So what I hope that was clarified in this video was, firstly, there's things that we do in day-to-day life that we can't avoid. We've got to live. Unfortunately, there is a negative impact on our spine for that reason. Thirdly, we can compensate for that via chiropractic adjustment, via regular work with your physio or osteo, via exercise, via easy to implement little practices during the day, for example, where you simply get up and sit down 5 times every half an hour or every 15 minutes. Or if you have to make a phone call, why not stand up, go for a walk while you're on the phone? Do whatever you can do to compensate for the time that spine's obliged to be immobile. Really important. And obviously, if you're sitting 6 to 8 hours, well, why wouldn't your spine deserve at least an hour of movement and exercise before you go to work, during your working period, or after work, okay? There's so much we can talk about, okay? There's so much is detailed in my course, Back in Action, or my book, The Secret of the Healthy Spine. It's so important that we become our own doctor and that we don't let dysfunction get to a point where we're going to depend on a disease specialist to be able to get us out of a symptomatic state. By that time, we've lost function. It's all about maintaining function, and it's all about learning how we do that, and we're not taught that at school. Most of us only think about it when we lose our health to a certain degree.